The center started July 1st of this year, so when we were planning this thing, the term was, you better be ready to hit the ground running. And that's exactly what's happened. We've had to hit the ground running. And I'm going to give you a little background about the center itself, just to make sure that it's clear on what we're trying to get done, where we're from, and what we're trying to get done, and then segue that into, as he said, the Seneca Valley virus experience. For the mission, focus on health of the U.S. swine herd. That's the whole point here. The mission is the focus on the health of the U.S. swine herd and how we can affect that, how we can directly affect that. Learning the lessons from PED, from PRRS, from circovirus, from the things that we've gotten, the things that we're going to get, to do global disease monitoring, to be targeted with research, to be prepared for those things that come. And the center, as USDA, the center cannot prevent these things from coming. But what we're going to try to do is make sure that we prioritize, we emphasize, we focus on the highest priority things that could happen, and then put targeted resources in research toward that, and an analysis of swine health data, all with that circle that comes around that'll affect the health of the U.S. swine herd. The scope of the work, just in brief and very brief, start at the left side of the slide. That global swine health and issues identification, employing the resources that are out in the country, in the U.S., as well as around the world, in the networks that are already in place. Not trying to reinvent a whole bunch of new networks and get people that aren't used to doing this thing, but coordinating the ones that are already in place. The animal health companies, the genetic companies, the universities, USDA, a host of others, all have these tentacles and all have these associations out internationally with health networks, because that's their job. That's their business. We haven't had a good way as an industry to coordinate all that together, to gather all that information together with the express purpose of going to the top of that and developing this list of prioritized diseases that we need to focus on because they provide us with the highest risk to the health of our herds in the future. That's the idea. PED came, supposedly, we identified it as coming from a province in China. There are other things there. There are other things, South America, North America, Canada, Mexico, Europe, Russia, Eastern Europe. All of those are areas that things are happening, and we're trying to gather that information to inform that disease matrix. And what that amounts to is listing the diseases, listing these viruses that put us at risk, and then asking the question about our preparedness for those viruses. Are we prepared diagnostically? Are we prepared informationally? What do we know about these diseases? And what do we have to find out about them in order to be prepared should they come to the U.S.? Then on the right side of this is the information, the monitoring and the information, and the helping of producers and veterinarians to be able to make decisions that affect the health of their herds on the farm in real time. If you start with the Swine Health Monitoring Project and the communication that's happened among those participants and the information that's come out of that in order to help the general industry, it's been amazing. The Swine Health Monitoring Project 10 years ago probably couldn't have happened. But with this global look and with this interest in sharing information and communicating, just like you heard from Christensen Farms, talk to me, show me mine, I'll show you yours, or show me yours, I'll show you mine, and we'll talk and we'll share information and we'll help each other. That, with then taking data out of that and using it to do risk analysis, is really going to form the basis and the foundation for the brass ring that we've got to strive for, and that's the secure pork supply. That secure pork supply is going to give us as an industry the ability, the theoretical ability so far, because it's still theory, but we're working on making it happen, the ability to continue to move pigs in the face of a highly contagious disease, i.e. FMD, classical swine fever, something like that. we're so dependent as a national herd now, rather than a farrow to finish farm. We've got a farrow to finish national herd. And we're so dependent on moving these pigs interstate from one area to another that we've got to, for business continuity, be able to continue to move pigs even in the face of one of those diseases. The communication, the trust, the cooperation that's built with the Swine Health Monitoring Project and the risk analysis affecting health will help lead to the communication, the biosecurity, and the surveillance that has to happen in the secure pork supply. And then that secure pork supply will help us to maintain, as best we can, or at least recover as quickly as possible, that trade support and the trade piece for the industry. So that's all that, but the question then is, how do I make decisions? What are we doing now? What are you doing for me right now? Hit the ground running and what's happening. And with the Swine Health Monitoring Project and also with others that are involved in this, the focus, to begin with, is PED and PRRS. Now, we're going to add Seneca Valley to this list, but the focus to begin with is PED and PRRS. PED is not old news, and understanding questions about first points of concentration, management practices, all of that is going to lead to the future of that disease in the U.S. Much of the information that we've been able to develop, and credit to the Pork Board for supplying the resources in order to be able to do that, and to the diagnostic labs and the researchers in the country that dropped everything and helped when PED hit. Credit those two and more, but credit them with that quick response. But much of the information that we've got about those pieces are based on one trial, are still based on one trial, maybe two. We're trying to put things together from different areas, and we still have, I tell you, you can't be totally confident that our experience from last winter is going to continue. We're doing the best we can with the information we have, but the focus on analyzing that data is going to help with our preparedness and our ability to respond to PED as we have to do in the future. PRRS, and everybody knows about the changes in PRRS and all of the issues we have with that. Analyzing health data, providing that information back to the industry is critical to how you affect the health of the pigs on the farm. The Swine Health Information Center is a separate 501c3. The National Pork Board funded it with supplemental fundings, a one-time supplemental grant to the Swine Health Information Center, but it's its own corporation. From that point on, after the Pork Board granted the money, it's hands off. And now we've got National Pork Board, National Pork Producers Council, American Association of Swine Veterinarians, and Swine Health Information Center. And as a separate corporation, there's a board of directors, and we have a 5-year plan. We have a 5-year lifetime to get to those goals that we have with that board of directors. The board of directors represented by Pork Board, NPPC, AASV, and then at-large producers in order to ensure that we get a good look at the future and how we should work. How we should work includes these pieces within our budget and with the plan of work. And if you take a look at 1 through 4, those are really informational research pieces that form a circle. That you start with communication, you start with the swine health issues, you work through the research, support graduate students, feed back to the industry, and keep that circle going. And then there's got to be 6, 5, 6, and 7, and 8 are structural issues to help the center go. There's 2 groups. As far as structure's gone, we formed 2 groups. One is a monitoring and analysis group. And this group is the one that is charged with that look over the hill internationally and nationally about diseases that are likely to come. They're charged with assessing risks, looking at risks, and gathering that information, prioritizing the disease matrix, and then also looking at nationally here, domestically, how we as a center and as the industry can help support this communication and this producer-to-producer cooperation that's developed and developing. The Preparedness group is the next one, and that's the one that's the actionable group based on the information from the analysis and monitoring. They're the group that takes that information and decides what research needs to be done. Targeted research that we have to have in order to meet the goals of being prepared. Also, that last bullet point is very important. Information and analysis necessary to support appropriate response to emerging swine diseases. That information is not just paper, but information is also research. What do we know about those diseases? What do we know about what we're likely to find? And how do we respond to the introduction? That's what that group's going to help with, both in information as far as paper and information as far as research. Because as I've gone out and talked to producers and talked to veterinarians and talked to a lot of people about the formation of the center and how it goes, the question about preparedness is fine. That's good, and yeah, we need to be more prepared. We can't stop things, so we have to be more prepared. But it always comes back to, but now, what are you going to do? How are we going to act if we get it? The conversation always comes to, so what's the response going to be? And that's a work in progress, but that, I think, keep that in mind as I talk about the research for Seneca Valley, because this is our first foray, our first opportunity to put into place the concepts and the philosophies of the Swine Health Information Center to help with that preparedness and with the response. So for those that weren't in the vesicular disease session yesterday, Seneca Valley virus has clinical signs that are wholly indistinguishable from foot and mouth disease. In 2007, we had a case in a packing plant. The inspector at the packing plant and the diagnostician that came said, I would have bet my career that was foot and mouth disease. And the same thing happens out on the farms this summer with the increased incidence of this. You cannot tell this syndrome from foot and mouth disease out on the farm, with the vesicular lesions on the nose, with the coronary band lesions, the lameness, all of that goes on with FMD. Why is it an issue? There's two things on this slide. One is a visual about an increase in incidence. You'll see on the left-hand side, on the y-axis, this is not an epidemic of hundreds of farms being infected. You've got to keep it in perspective of the number of farms that are infected here, but also look at the increase in incidence that has gone on from last year compared to this year, and that is only as of the middle of August. There's more. There's more that's out there, and the activity is there, and it continues. So the question is, if the Swine Health Information Center is going to help with emerging diseases, let's define this and figure out if this is an emerging disease, and therefore how to respond. So that's one thing. We've got an increase in incidence. There's no doubt about that. No doubt about that virus is being found more often with clinical signs this summer than historically we've had. It's been in the country since 1988, and it's been a sporadic disease that primarily has been, the issue with it is that it looks like foot and mouth disease. We're getting more and more production issues this summer, which leads to the question about emerging disease. If you look at the list of states, that's another one that could be a visual here, but that list of states goes all the way from the south in Alabama and Oklahoma, through the southeast, Florida, Georgia, North Carolina, through the Midwest, all the way through the Midwest from Ohio, Illinois, Iowa, Minnesota, and then Hawaii. So what we found, and what our information tells us, is this virus is national in scope. It still is sporadic in incidence, but it's national in scope. And that leads to help inform what a reasonable response plan should be. So as SHIC has worked on research, and those first 3 points here, the serial sampling and the screening of oral fluids, that was all designed as part of that, gather this information about the scope of infection in order to help inform response. That had to be done quickly, and to the credits, again, of the diagnostic labs and the universities and the researchers, that's going on. Yesterday, at 5 o'clock, was the close of the call for proposals for Koch's postulates, sequencing, and diagnostics. This virus is associated with clinical disease. There's no doubt about that. But there's a wide range of clinical presentations, a very wide range of clinical presentations. And the virus is found in non-clinical pigs as well. So the question is, and we've never been, since 1988, it's been tried unsuccessfully to test Koch's postulates against this virus in normal pigs. It's never been done successfully. We've got to look at different ways at how to do that, because the issue is going to be, maybe this is a red herring that we're just looking at. It's a shiny object, and we're finding Seneca Valley. But there's really something else there. We need to understand that. We need to find that out in order to inform, again, response plans and how we work. The sequencing, a question of historical versus contemporary versus other viruses that are around the world, and do we have different strains that are causing these different clinical presentations? Very important question, again, for how we respond. The diagnostics, we don't have serology for this virus yet. That hasn't been developed. PCRs are good. Virus isolation is good, but we've got to be able to have some serology help in order to better understand distribution and clinical presentation and resolvement. The last piece that's being funded is disinfectants. So we've got a question of how do I act on the farm? How long do I expect shedding? Therefore, when do I market, or what do I move, or how does that work? And especially, when can I bring new animals in? And what do I expect with them? So that's a shedding issue. And then we've got Koch's postulates and sequencing to understand the virus. Lastly, this is a picornavirus like FMD, but those experts say that you can't extrapolate the disinfectants that are effective against FMD into Seneca Valley. The first look at this was that assumption of extrapolation, and we've learned that no, that's not right. So we've got to go. We're doing some efficacy of disinfectants work that's going to be done very quickly. The other part of the Swine Health Information Center is communication and coordination. I put that focus on FAD investigations right up at the top, and go on with all of the conference calls, all of the things that have happened as far as coordinating the research, the researchers, the actions, having conference calls with the state animal health officials, with the packers, all to inform, so we don't have overreaction. We have information and we have response, but not overreaction. That's part of the goal. The SVV fact sheet. We've developed fact sheets about this, and also updates on what's going on. They're available at the National Pork Board table. And finally, quickly mention the AASV Swine Health Committee. In the draft response plan that the National Pork Board, NPPC, AASV are working on, it includes some sort of a decision-making body, and whatever it's called, a decision-making body of producers and veterinarians sitting down and saying, here's how we think that we should act in the face of this emerging disease, with state animal health officials and federal animal health officials in partnership there, so they hear this, and working together, making sure that that loop is closed. But there's got to be some sort of a decision-making body or some sort of decision-making process in order to say, how do we act? And we don't have that body yet formed. That's not up and standing yet. So, to the credit of the AASV Swine Health Committee, they took the mantle on this, and with the information that we were able to give them, with that distribution information and the state of the virus at this point, they had a conference call and they came up with these points. And I highlighted the things to focus on, because those are the things that really affect the farm and how we act. Intensive observation, and then what do you do when that happens? When you see these as a veterinarian or as a producer, what do you do when that happens? Sit down, stay at the site, don't leave. Call the state animal health official. Stop movement. Stop movement while this is going on. You don't know that this is an FMD. Stop everything that's going on, sit on the farm, call the state animal health official or the federal animal health official. Then the questions become, well, then what do I do after I do that? do whatever they tell you to do. That's what you do. Stay there and call and get the advice of the state animal health official, the federal animal health officials, because you don't know that you don't have the first case of FMD in the country since 1929. But once then you find out you don't, then what happens? Don't market pigs that are ill. Don't market clinically ill pigs. That's a common tenet for producers. Do not market clinically ill pigs, and that includes Seneca Valley virus. So pigs that have active lesions, you're putting at risk both yourself and the plant marketing pigs with active lesions. Some of the experience we've had on finishing floors this summer has been that it takes a rather prolonged, sometimes it can take a prolonged period of time for a finishing floor to get over. And so when that happens, when they start to heal, if you have to market, then that communication loop is extremely important. The communication loop to the plant, with your veterinarian, to the plant, to the FSIS official, the plant officials, the FSIS officials, everybody knows the history of these pigs and what's coming in, because we can't risk affecting commerce by shutting down plants. That's been the communication loop with this, and that's what we've been trying to do.